I'm DentistJess. Welcome to my channel. I'm so glad that you're here today. We are going to be talking about wisdom teeth and what is all the hype with wisdom teeth. I created this channel so that I could share some fun oral health topics with you, so make sure to stay tuned. I'm DentistJess, this here is Honey, and we just wanted to take a moment and tell you why we started this channel. I am a firm believer in oral health. I think that it's such an important part. Our mouth is the entryway to our body, and I noticed that a lot of times people don't really know why we're supposed to go to the dentist or why wisdom teeth are such a big deal. And so I wanted to just create a community where you felt comfortable and realize that there's people like me that are dentists too with our dogs, and that we just wanted to connect with you and say, hey, you know what, if you have questions, I'm here. I just wanted to put out some content and videos on YouTube that will let you know information maybe you were wondering about your oral health. So that's kind of why I started this channel. Honey wanted to pop in and say hi today, so yeah, okay, we'll dive right in. Goodbye. All right, so have you ever wondered what is all the hype with wisdom teeth? Why are they such a big deal? Well, let's start first off by saying wisdom teeth are our third molars. So in the dental chair, we'll call them our third molars. They typically come in around 17 to 21 years old, and they're not that typical. So there's a lot of variation when they come in, how they come in, the orientation they come in, and I've had patients that don't have any wisdom teeth at all. 1, 2, 3, or 4, there's a lot of variability. So that's why they're kind of one of those teeth that's like, because they have so many different ways and types that they come in. But they are definitely one of the most common teeth to have taken out. So I'm gonna give you a few reasons why we usually take your wisdom teeth out. Because I get this question a lot, like, hey, is it okay if I just leave them in? Or why do people always have to get their teeth taken out? So I want to take a couple minutes and just talk to you about why we want to take them out. What are maybe some of the signs or reasons that you need to get your teeth taken out? And what can you do if you think that your wisdom teeth are bothering you? So make sure to stay till the end for some tips on how to take care of it if you think that your wisdom teeth might be giving you a bit of a problem. Okay, so let's start off with some of the most common reasons that you might need to have your wisdom teeth removed. One of the main reasons that we have to have our teeth removed, our wisdom teeth removed, is because there is just not enough room. So a lot of the times, we have orthodontics or braces at baseline a lot because a lot of us have misaligned or just not enough space in our mouths. So sometimes we'll actually take out the wisdom teeth because we just wouldn't have enough space. And what happens is that as they come up through the gums, they start to push all the other teeth forward, and it causes all this misalignment and cause a whole bunch of other problems. So sometimes we'll just take them out because there's just not enough room. Another reason that they often get taken out is because they are really prone to infection. So sometimes when they're just partly erupted, we get an infection that happens kind of under the gum because it's really hard to keep clean in there. Sometimes the tooth gets infected itself because it's hard to clean. Sometimes there can be an infection even in the bone if the tooth hasn't erupted. So sometimes we'll just take them out prophylactically so that we don't have cause for infection later on. Another common reason that they're removed is they are really prone to having a cyst or tumor formation down the road. So you can get something called a dentigerous cyst, which actually could evolve to some kind of cancer in the future. So sometimes we'll just take them out again just to prevent that from happening in the future. Another reason that we take them out, and this one I actually see quite often, especially if the tooth has already erupted, meaning it's come into the mouth, is that it is just really hard for people to keep clean, and it ends up getting infected and decayed, and then they have a toothache. So sometimes if the tooth is really hard to keep clean and we see that it's got a big cavity on it, we'll just take it out because the chances of being able to restore it properly and healthy and have you be able to maintain that restoration and keep it really clean and cavity free is just really challenging. So sometimes if it's prone to getting an infection, prone to getting decay, and it's just really hard to keep clean, we just will take it out. And the final reason is that it may be damaging the tooth in front of it or opposing it. More often than not, though, what happens if you've got one tooth coming in and another one coming in at an angle, if this one starts to get infected or decayed right kind of on that spot, it'll hit into the other tooth and it can end up damaging both teeth. And I've actually seen a few cases where both teeth have to be removed because the wisdom tooth was impacted into the tooth in front of it, and they both ended up getting huge infections, lost the tooth, and so really quite sad. So sometimes if it's bumping up into its neighbor too much, we might just take it out so that it doesn't cause further damage to the adjacent teeth down the road. Okay, so that's why we take them out, but how do you know if you need to have it taken out? What do you do if you're like, I think my wisdom teeth could be bothering me, but I'm not really sure? So what are some signs that you should look for if you think that your wisdom teeth might be bothering you? So number one, a dull ache. It's not usually a sharp pain, it's kind of more of a dull ache, and you tend to get this soreness that kind of radiates in and around the jaw. So lots of the time people come in and they're like, oh, my ear kind of hurts or my jaw is really sore. It could be due to your wisdom teeth. Another reason is if you really notice that your gums are starting to bleed a lot or they're getting really, really tender right behind those second molars. So if your teeth are maybe starting to come in, you might feel just kind of like babies when they're teething, you get this like swollen, sore gums. If you're noticing a lot more bleeding back there, it could mean that your wisdom tooth is coming in. Another thing that we find quite often is that you end up having actually a hard time opening your mouth because you start to get some swelling right back here where your jaw is. And so when you try to open, it just kind of, you can't open it fully because it's all swollen there. So another thing is a hard time opening your mouth. Another common sign and symptom is a bad taste in your mouth, or you have really bad breath that just kind of came out of nowhere and you're like, ooh, what is that smell? What is that taste? It's usually from an infection that's starting to occur. So if that's happening, you probably should get in to see a dentist soon. Another common sign is, like I said, if you're starting to notice that your teeth are crowding together, it might mean your wisdom teeth are coming through and they are pushing those other teeth out of their way, which can cause problems down the road. So if you're noticing increased crowding around your teeth, maybe it's time to get those wisdom teeth checked out. One of the things with wisdom teeth in particular, unlike most other toothaches, is that you kind of get this intermittent, this soreness that comes and goes and comes and goes. It's not really constant. It's not something that's like, oh man, I have a toothache, I need to go get this fixed right now. You're like, oh, it's kind of aching and sore, and then tomorrow it's not as bad. And then the next night it's like, oh, I really should take something for this, it hurts. And so it's not really easy to peg down. It's kind of this soreness that keeps coming and going and coming and going. So what do you do if you're like, hey, a few of those things she just mentioned are me. I have this aching kind of coming and going. I feel like I have this really bad taste in my mouth. My teeth might be crowding a little bit more and I'm not really sure what to do. So what do you do if you think that your wisdom teeth are bothering you? The number one thing, and of course I'm going to say this, I'm a dentist, is that you need to go see your dentist because they need to do an evaluation of you and see if it might be time to have those wisdom teeth taken out. Typically, what they will do is they will take a panoramic x-ray. This is a big x-ray that kind of spins around your head. There's a little video of it I can kind of show you. And what it'll do is it'll allow them to see where the wisdom teeth are actually located in relation to your jaws, the other teeth, to the surrounding structure. So that's really important so they can see what they're kind of maybe bumping into. Another thing that you can do that's really helpful is to actually just apply cool compresses to your jaw. So right again on the top, it's kind of just right in line with this little spot on your ear. You kind of go over it, put one right here, and then on the bottom it's kind of where this angle is here of your lower jaw. It'll help a lot to just to put some ice on there to help if you're having any swelling. Another thing you can do is a warm saltwater rinse. You put a teaspoon of salt in a quarter cup of warm water, and it'll just kind of help again to clean out if you do have an infection starting, and it helps to kind of soothe the gums a little bit. And then finally, you can take some over-the-counter medications as long as it's okay with your physician. Either ibuprofen or acetaminophen work really well. If you're having a lot of pain, you can sometimes alternate them, but again, it's best to check with your healthcare professional to make sure that it's okay for you to do that. Otherwise, the most important thing you can do is call and make an appointment with your dentist to see if it is time to get those babies out. All right, that's what I have for you today. If you liked it, please make sure to subscribe, ring that bell, join our community, and make these videos because I love being able to teach what I know as a dentist back to all of you. So make sure to stay tuned, check out some of my other videos on my channel, and we will see you next time.